In this video, I will show you the truth about cancer treatment that many patients ignore. Today, 2 out of 3 patients are cured, and this is a fact. Medicine has stepped forward dramatically. But why after successful treatment, doctors don't say that you are healthy? Why after surgery do they prescribe additional chemotherapy? And the main question, why does the disease come back for some patients but not for others? Today, I will cover 2 main topics that worry every patient who faces the cancer: cure and recurrence. I will explain in simple words what it is, why the disease can come back, and most importantly, what to do to prevent it. Let's jump into it. So what exactly is remission? It's when after treatment we can't find any trace of the tumor. It doesn't show up on ultrasound, CT scan, or any other tests. As far as we can tell, the disease is gone. There are 2 types of remission: complete, when the tumor disappeared completely without any traces, and partial, when the tumor decreased during treatment and went silent. It's there, but under control. Now the main question: why the doctors very carefully with the phrase "you are completely healthy"? Here's the critical point. Because cancer is a very special disease. Even if we don't see the tumor, single cancer cells can remain in the body. They are very small, not detected on CT scan, sleeping, and show no signs. But sometimes they activate after years and the disease starts again. That's exactly why modern oncology talks about remission, not cure. We won the battle, but the war is not over. Remission is a huge achievement. It means treatment worked. You got time and you are under control. And now, let's move on to everyone's fears. Recurrence. This means the disease has come back, when the tumor starts to grow again after treatment. Why does this happen? This is the main question for both doctor and patient. Imagine, the surgeon removes the tumor and everything goes perfectly. But before the surgery, a few cancer cells had already slipped into the blood or lymphatic system. They traveled through the body and spread to the lungs, liver, or bones and went silent. They can lie undetected for months, potentially even years. And then they start growing. That's why sometimes after surgery or radiation therapy they prescribe additional chemotherapy to kill those cells that could spread before surgery. Next step. So what really guides the risk of recurrence? First of all, the stage of the disease. In oncology, there are 4 of them. The earliest stage is the first one, when the tumor is small and hasn't spread beyond the organ. And 4th, when the disease spread across the body with a lot of metastases. The lower the stage, the lower the risk. So, patients with the first stage has no risk of tumor recurrence. Second factor is the tumor biology. Not all tumors are the same. Some are very aggressive. They grow fast and give metastasis early. Others are very slow. Don't give metastasis and don't kill at all. For example, there is a type of prostate cancer that doesn't give metastasis and doesn't kill. And its treatment brings no benefits. It means that some patients who can be on active surveillance have to know about it. There are 2 types of recurrences. Local recurrence, when the tumor grows again exactly in the same place where surgery was. In other words, the surgeon removed the tumor, but a single cancer cell was left behind. And that cell grew into a new tumor. And distant recurrence, when the disease is detected in other organs and called metastasis. Same cells that spread through the body before surgery. That's why we sometimes give a short course of chemotherapy right after the surgery, to kill any cells that might be hiding. Next important question. You should distinguish a new tumor from the return of the old one. What do I mean? Cancer is primarily a genetic breakdown of cells of a specific tissue. For example, kidney cancer is a disease of kidney tissue. There are surgeries to remove kidney cancer while saving the kidney itself. Tumor is fully removed and the place of surgery is clean, but the kidney tissue is still there. This means that later a new tumor could appear in the same kidney, just in a different area, or in the opposite kidney. Unlike prostate cancer, when the prostate gland is fully removed together with the tumor. But there is a good news. Metastasis in modern oncology no longer mean the disease cannot be fully cured. Recently, in oncology, there was a rule. If after surgery or radiation therapy metastasis appeared, there was no hope for a full cure, and the patient was prescribed chemotherapy. Today, we have the possibility for a full victory over cancer, even with metastasis. For example, in prostate cancer treatment, we have a modern contrast agent that attached exclusively to prostate cancer cells and light up during a PET scan. Now, we know exactly where metastases are and how many there are. Today it's proven that precise radiation on metastasis gives more than hope. It leads to a complete victory over cancer. I have 15 years of experience at top oncological clinics, including Hadassah Hospital and European Medical Center. Need to find out your condition or get a second opinion? Link in description below. And now, what should you do to minimize recurrence risk? There are things we can change and things we cannot. That's exactly why we must do everything that depends on us. First, follow the treatment plan completely. If chemotherapy is prescribed, finish the full course. If radiation therapy is recommended, go through with it. Because if it's indicated, it means its effectiveness is proven in large studies. Second, stick to your follow-up exam schedule. After any treatment, there is a schedule of control examinations. Depending on diagnosis, it might be CT scan, MRI, or blood tumor markers. Don't miss them. Smoking is a leading cause not only of lung cancer, but also kidney and bladder cancer. Research has proven that patients who continue to smoke during and after treatment have a significantly higher risk of recurrence.